Hello, everyone. I think we can start. Our speaker is here, and also the manager of the program, Ayşenur, is here. Greetings from Istanbul, and good evening from Istanbul, and good morning from California. I hope you are sound and well anywhere in the world. I would like to welcome you on behalf of Ali Vural Ag Center for Global Islamic Studies. As some of you may know, our center is hosting a lecture series on COVID-19 and Muslim religiosity, covering Muslim communities' responses across the world in different aspects of this responses. And in this series, this is the first historical talk because we thought that this aspect is missing because we are so bogged down in the current affairs. However, there's tremendous scholarship, of course, developed before the COVID on the history of epidemics or pandemics in history, particularly Ottoman and Middle Eastern history, and we are particularly lucky, quote unquote, of course, in this regard, because the history of pandemics was one of the most or better documented in Ottoman history. And this on this occasion, we have fortunately one of the foremost experts on the topic, whom I will introduce shortly. But before that, I would like to remind you that this series will continue. Next week, for example, we have um, um, a guest lecture series, continue with Daryl Lee. The topic is the universal enemy, jihad, empire, and the challenge of solidarity. Soon after, on November 20th, we have the fourth annual graduate student book review colloquium on Islamic and Middle Eastern studies, which is a day-long event with 8 presentations. We hope you can join in all these events, which will continue into December. And Ayşenur, I hope will pass you the information by email and on the chat box as well. Also, to just let you know that these webinars are recorded and posted on the center's Vimeo account. So if you'd like to share or watch it again, you'll find it there recorded. So that said, let me introduce my colleague and long-term friend, Günhan Börekçi, who is currently a visiting professor at the Department of Medieval Studies in Central European University, Vienna. After completing his BA and MA at Boğaziçi University, which is my alma mater as well, Dr. Börekçi received his PhD in history from Ohio State University in 2010. His main areas of research and teaching include pre-modern Ottoman political, dynastic, and social history, 17th century global crisis, military history, history of horsemanship, and traditional archery, all the exciting stuff. His study on the Ottoman imperial campaign against the Habsburgs in 1596 came out under the title Macaristan'da bir Osmanlı padişahı, Sultan 3. Mehmet'in Eğri Seferi Ruznamesi. Dr. Börekçi is currently working on 2 new book projects, one on the factions and favorites at the Ottoman Imperial Court, and a short biography of Sultan Ahmed I. After his presentation, he'll take questions in a Q&A session. That said, without further ado, Günhan, the floor is yours. And thank you for joining us.
Thank you so much for your invitation. This is a pleasure and a great honor to present something within the constrained time. We are truly going in a very unusual pandemic now. And I'm not an expert on the history of pandemics or epidemics or diseases in the Ottoman history. but I will refer to some of our expert colleagues in this. So I welcome everyone. Inshallah, everyone is fine, your loved ones. This is really a very challenging time. And as of today, this is the World Health Organization's data. COVID is now taking an enormous toll on the entire world population. We have now confirmed more than 54 million cases and deaths exceeding 1.3 million. Of course, epidemics, pandemics were part of our lives through the recorded human history. And scholars, scientists, epidemiologists have been warning us actually in the last century or so about the possible repercussions of impending pandemics. Of course, for us historians, I mean, any period that we look into, there's always the shadow of one form of disease. And in the case of Ottomans, honestly, from the 15th century all the way to the 19th century, any year that you read an account, there's always a disease overshadowing some parts of the social life or individual lives. So I was very much interested in this topic because I was working on the reign of Ahmed I, who survived actually one of the epidemics that was a smallpox. And that smallpox almost brought the male line of Ottoman dynasty to an end in the year 1603. So I started to look into the larger patterns of smallpox and discovered that actually it continued to be one of the most deadly diseases that roamed over the Ottoman lands pretty much from the 16th to the 19th centuries until especially cholera came. And the smallpox, of course, came much less effective thanks to the vaccinations developed in the 18th to 19th centuries. Here is a quotation that I found recently. I don't want to read the whole thing, but this was an edition called Global Epidemics by Christopher Marie, who says this in his introductory remarks. All that, given about the pandemics or epidemics and pandemics in world history, we know that it has been a tremendously history-changing disease, and it truly exacted incalculable tolls on us, threatened our societies, destroyed our ways of life. And no country in the world, as we experience today under COVID-19, is exempt from this disease pandemics. So one of the, of course, most recent memory, for instance, my father remembers, is the 1950s and the 1960s, Asian flu that was already heard, for instance, in Turkey at the time. And of course, the most perhaps memorable pandemic was the great influenza pandemic of 1918 and 19, known as the Spanish flu. And within 12 months, that flu killed at least 50 million. And here is what Marie says, that if such an outbreak like that Spanish flu were to occur today, and indeed, unfortunately, we are experiencing it, when people and the germs they carry can travel across the planet in a matter of hours, the toll could be even far more greater. And indeed, this is the moment, we once again try to understand what is happening. I'm sure every one of us, when we start hearing about COVID-19, started to wonder, okay, what is going to happen? Is it coming our way? And next thing we know, it came our doorsteps. And of course, one of the questions that people start asking was, okay, was there any disease, any pandemic like this before in history? And maybe this is one of the times also kind of benefiting to the historians, particularly working on this topic of history of diseases, is that it created an enormous thirst to know more about what went or what passed, and what kind of lessons, what kind of tips we can get from the earlier cases. And indeed, as Hussein mentioned in his introductory remarks, that there is a substantial scholarship on the history of diseases in world history. When it comes to the Ottomans, unfortunately, we cannot maybe say that we have a large secondary or scholarly literature that covers pretty much all the diseases, all the periods. But it is developing very fast. And here are some covers of the books that are very much important and in certain ways groundbreaking, starting from Michael Dodd's The Black Death in the Middle East, Daniel Panzak, La Peste dans l'Empire Ottoman, Nükhet Varlık's Plague and Ottoman in the Early Modern Mediterranean World, Yaron Ayolan's Natural Disasters in the Ottoman Empire, Plague, Famine and Other Misfortunes, Zafer Karademir's İmparatorluğun Açlıkla İmtihanı, and Birsen Bulmuş's Plague, Quarantines and Geopolitics in the Ottoman Empire. These are few titles among many that actually examines different periods, different topics, all in relation to the epidemics and other related catastrophes. Today, I like to talk about one particular aspect of this long story, long and complex story. That is the socio-economic effects of epidemics, not pandemics, because we are talking about only the territories of the Ottoman Empire, which in this map you can see on your screen covers quite a landmass from the gates of Vienna to the Gulf War. To the Indian Ocean, Persian Gulf War, northern shores of the African coasts, the Levant in general, all the way what's today Kurdistan and Iran. The Ottoman Empire was one of the largest and long-lasting empires in world history, as I'm sure most of you know. Now, when it comes to the history of diseases in relation to Ottoman history, there are a couple of points maybe we should make at this moment. One is that diseases traveled together with humans, and the overall networks, as Nükhet Varlık calls it, the networks of plagues in the Ottoman Empire, of course, converged in the capital city of Istanbul, particularly after 1453. Here on this map, you can see, which is from Varlık's Plague and Empire book, you can see how different routes are converging in Istanbul. Over here, you can see it. And the data that we are about to see is that there are major cities that were more severely affected by the impact of epidemics, and most notably plague. Plague was the most frequently occurring contagious disease of the time. So what I want to go over is besides the higher rates of mortality, no doubt, we just again see it from our own lives today, there were a couple of topics I consider to note for your information. One is, of course, that these diseases created migrations, sometimes in mass numbers or displacement from one location to another. People were fearing of their lives, simply run away. And that created, for a long time, what is known as the problem of abandoned villages or towns. So geographically, this displacement of populations created the problem of long-term economic downward or disruptions in the economic life of a given region, which also experience serious sectors in the production line going either in recession or sometimes closure. Of course, one of the most important effects of the epidemics was that it created scarcity of food because of the disruptions in the economic and other areas of activity, daily life activity. And together with that came sharp increases in prices. And altogether, it created a general, what I call general welfare crisis. There's another important aspect of the epidemics that it also, in certain areas where certain trade regions, that we see a shift in the routes. And these are all interrelated problems in a way. And also security problems that due to the high rates of mortality, people in charge of, securing trade routes, urban life, customs, etc. When they are not in charge, either because of their death or run away, security have become a serious issue in time. Just to give you an idea about how frequently these epidemics occurred, here is another figure from my colleague Nükhet Varlık's book that in different parts of the empire, Ottoman Empire, we see that from the later part of the 15th century onwards, these epidemics, particularly plague epidemics, became almost a norm in a given decade. You can see here that, for instance, Istanbul has almost, every single decade, one epidemic plague. The Balkans, the Aegean, they similarly had almost frequently. And Anatolia, despite this data doesn't show that it also concurs with this general pattern. But what is striking about the plague, particularly plague, is that it spreads much more fastly through the port cities. Ships coming from different ports carried people sick with the disease. For instance, in Istanbul, as you can see on this chart, again, by decade, there's only very few decades that we don't see a serious outbreak. One of the again, a table for making this easy to see is that when we look at the plague epidemics, for instance, in the 16th century, you can see here in the Balkans, in the 17th century again, here in the Balkans, and even in the 18th century here in the Balkans, that plague simply roamed all in certain important regions of the empire. Actually, I also like to use the term coined by Nükhet Varlık, that when we look at these charts, when we look at the frequency of these diseases, that Ottoman Empire was an empire of plague, empire of epidemics, empire of contagious diseases. And today, when we consider our memory, how far we can actually recall anything that was kind of, passed through the generations up until today, not much. We don't really know in our high school years, how frequently these past people had to go through what we are experiencing today. That's to say, a form of disease either affecting their region, affecting their town, or affecting, a neighboring country, but still, worrying about it. From Panzac's book, which is still one of the unsurpassed studies of the history of plague in the Ottoman Empire, here is some numbers just to give another idea of what we are talking about, the details. Panzac's book is covering the period of 1700 to 1850. So here, of course, earlier data should be included into what he's presenting us. And you can see here the regions of the Ottoman Empire, from Egypt to the vassal states of Moldavia to Wallachia. And these are in three 50 years period. And this is the annual occurrences of the plague. And you can see here Egypt, which is a major port area, and Aegean, Anatolia, particularly Izmir and its surroundings, and of course the capital city, Istanbul. They are the highest number cities in terms of these occurrences. And here is what we see, how long these plague epidemics lasted on an annual base. Again, as you can see here, the Anatolian coastline of Aegean region is quite higher than many others, but still number one is Istanbul, almost 4.2. So going back to the effects of the epidemics, mass migration, for instance, we see in many cases in the 16th century and 17th century, all these mass migrations that we can find in the Ottoman archival materials, narrative sources, or traveler accounts, they are all interrelated to several other factors. So when we are talking about the socioeconomic effects of epidemics, we should also consider what other factors were at play. For instance, wars. Especially in the 16th and 17th centuries, when Ottoman Empire was engaged at wars, and some are long-term wars, those soldiers that were especially returning from the campaigns brought with them diseases. The famous Celali rebellions of the late 16th and early 17th century. Similarly, we see in the accounts of the time that several towns were affected by plague or smallpox. And when we trace back the origins, that we can see that it started right after a campaign ended. Abandoned villages, again, is another issue. Banditry can be one reason. Climatic changes that affect harvest failures, creating famines can be another reason. But in every time, there is a correlation between the diseases and other factors. For instance, we know that when there are wet summers, certain type of viruses could be spreading much more quickly. And indeed, the recent climatic data we have on the Anatolia and the Balkans point out that there is a positive correlation between the frequency of the epidemics, such as plague, and the declining climate conditions. Economic life, of course, is clearly the first area that displays this massive impact of the epidemics. Several towns, for instance, Thessaloniki, which was producing very important materials for the Ottoman army, such as the Janissaries clothing in dyes. For instance, in the 17th century, they had to reduce their production by almost half. So that's, for instance, one of the examples to keep in mind. As we experience today, logistical lines can be disrupted, and people immediately start feeling the effect of these disrupted economy. And indeed, when we look at the history of epidemics, we also see a history of famine. Zafer Karademir, our colleague whom I mentioned earlier, his book is about the 16th and 17th century famines. And indeed, he also finds several of these positive correlations with other factors affecting the societal and economic life. But famine was also important because it reduced people's immune system in a way that could be very critical in combating the diseases. So when there were long periods of famine, we see that the mortality rate also goes up. Children were also very much affected. Smallpox was a terrible and serious epidemic of the time. Unfortunately, we still don't know much about smallpox, despite, as I said, I started to work on it. But apparently, this was also maybe a second, I would say, deadly disease after the plague. for a long time in the Ottoman history. Now I want to give you a few more details about what we know about the outbreaks of plague. For instance, this is just from the year of 1762 outbreak that happened in Izmir. Panzak gives these mortality rates. I'm sorry, the image might be a little blurry, but as you can see, like we again experienced today, that the numbers kept increasing. We see that in March, while almost 10 deaths were reported, by September, it was 1,000. And the highest, typically highest points of these epidemics, like in this case, come in the summers. From June to August, the average death from the plague was more than 1,000, with a peak in July by 4,500. I want to also share with you a little bit of how people reacted, how people put down their experiences of these diseases, epidemics. One of the least known, I will say, chronicle is the journal of Zakaria of Agulist, a deacon from the town of Agulis, a former Armenian town, which, if I'm not wrong today, lies in the Azerbaijan. And he wrote this chronicle from not just about his town, but also the neighboring areas with the Ottoman Empire. So that's actually another kind of a frontier region where so much war was going on. And here one quotation is from the year 1667. This actually feels right between two epidemics that we see in that area, in the Eastern Black Sea and Caucasian area. Hence, when there was no plague, there was another disease, which in this case, as he says, that from the beginning of this year, there occurred such unprecedented diseases and calamities like smallpox, deaths, disasters, banditry, and theft, that 100-year-old men were amazed and stated that they had not witnessed anything similar in their lifetime. And he continues, during this year, there was such a terrible epidemic of smallpox that is in Ogulist alone, 200 children died, not to mention those who died from other diseases. And then almost a decade later, he notes that again in Ogulist, smallpox appeared on children and many children died, and it continued until the end of July, again, the high point of this seasonal epidemics. And he also notes that there was no household that escaped it. Indeed, this was another important aspect that, as we experience now, unfortunately, again, every day, is that it just comes to our doorsteps. And indeed, back in time, it was a similar situation. Here is another chronicle, Zakaria of Kanaker, again from Armenia, who traveled, by the way, through Anatolia and recorded his observations. And he mentions a famine, which actually right before another epidemic erupted in Izmir, in Smyrna. And this was a city, for those of you who are not familiar, was quite a mixture of people. The majority of the population at the time, like 60 to 65%, were Muslim. And the rest of the population, the non-Muslim population, had included Armenians, Jews, and those merchants from European nations, and Franks, as the people of the time called them. And what happened at this time, as Zakaria of Kanaker mentions, is that that grain became a major issue because the trade was suddenly cut. And then immediately, as you can see, I'm sorry, that everything became expensive. So the scarcity of food created an increase in the prices. And then he mentions about what kind of an impact the famine had right there before the epidemics, is that it became worse and worse as time went on, and people started to eat unclean animals. When there were no unclean elements left, they began to gather horse manure, grinding it, baking bread out of it. They also gathered bones, crushed them with axes, ground them, and made bread of them. It was possible to eat without while it was warm, but the moment it became stale, it was inedible. They then smashed it and ate it. And then later on, he even mentions another important effect of these calamities, that many Christians, in order to feed themselves in the face of such famine, sold their sons and daughters to the Muslims for a low price. Many left their young at the doors of Muslim houses and ran away. The Muslims then took these children and raised them as their own. So here is, I think, a great testimony, for instance, that we rarely see, this very daily tragedy going on. But apparently, based on Zachariah's account, we can say that people took care of their also loved ones. If they cannot, they ask the help of their neighbors. And in this case, Muslims of the area took care of the non-Muslims' children. And Zachariah mentions they raised them as their own. I'd like to mention also another account here, that from the perspective of the epidemics, of course, we can again correlate what was going on. For instance, as I mentioned, climatic abnormalities, which was another feature of this period, that we see, for instance, locusts come from African and other Arab, especially deserts. And together with the locusts came famine, because they eat, as many of you know, the harvests. And then, of course, there's another unfortunate era. We see an earthquake, for instance, hitting Izmir. And all these coming together, of course, created a massive catastrophe, massive calamity. And all the areas, all the areas that we see in the Ottoman Empire went similar stages. And indeed, when we are looking at the recorded history, we can actually see the responses of the people, but also the government. Now, this is not a talk about how the Ottoman government responded. That will be actually a nice topic to discuss later on, because Ottoman government was also quite responsive. Of course, after the fact, because they could not estimate, they could not wait or get ready for it. But when an epidemic hit a region, they typically took the first measures. Quarantines came much later, but Ottomans were very much careful and vigilant about keeping the city clean, which was a very important, of course, measure. They try to separate the sick from the healthy people, and of course, burying the dead people from the diseases outside of the city. So in a way, Ottoman health system tried its best to cope with these disasters. Only later, of course, as we know, before the advent of modern medicine, they had limited resources, but still, I think it was an important point to make. So without, I think, boring you with too many details and numbers, I would like to end my talk and look forward to your questions. Thank you so much.
Thank you so much, Günhan, for this very vivid presentation of how pre-moderns suffered and reacted and responded and handled pandemics. And now the floor is open for questions. Those who are interested to ask questions or make brief comments, please unmute and directly ask your question to our presenter.
Hello, I have a question.
Yes, please.
Okay, so we know your works on the war in Ottoman, like your wars with the Habsburgs and others. So how do the pandemics affect the wars? Like the frequency of the wars, the outcomes, those who are hit more by the pandemics, like like and their wartime performances. Like, so can you a little bit maybe talk about this issue as well? Thank you.
Of course, yes. Thank you for the question. This is something I can talk for hours, but I won't do that. Thank you, Said. Indeed, the diseases, especially contagious diseases like plague, smallpox, and flu, or any virus, I would say, that is contagious, definitely had an impact on the military, Ottoman military, Ottoman soldiers, and the campaigns. But there's also a kind of awareness on the Ottoman, I would say, soldiers, that they knew that these problems can happen. So they also tried their best to keep like social distancing in a way, that, for instance, they kept their, their tents, those places where, for instance, animals were butchered, all in an organized fashion. So this is, for instance, what we can see. But when a disease hit, indeed it hit, because we are talking about thousands and thousands of men, and even civilians, also in the numbers of tens and thousands. So they had experienced it in a way, and particularly during the long wars under very like extreme weather conditions. I can give you one example, for instance, from the years of 1597, 98. We know that the winters were very cold at the time, and there was a plague epidemic, and literally Ottoman soldiers were decimated. Many couldn't make home. They died on the way back from the campaign. Some actually died in the trenches, not just because of the cold, but also what seems to be a flu. So yes, indeed, the army also suffered much. Did it affect the outcome of the battle? Well, sometimes yes, sometimes no. We don't know actually the direct impact of these diseases on such moments, such cases. I hope this answers your question.
Thank you.
Any other question?
I have a question, Günhan.
Please.
You covered a pretty long period of 300 centuries. Do we have examples or patterns of how the authorities reacted in terms of, I'm most curious about whether they learn how to contain epidemics or plague to recur in the future by the past examples. So are there those measures in terms of that incremental knowledge taken by the authorities?
Thank you, Hussein. Very good and difficult question. Of course, our expert friend, scholar, Nükhet Varlık, mentions that, first of all, Ottomans or Muslims were not passive in the face of such calamities, such disasters. They knew what to do. And of course, that memory and experience accumulated in time. Now, if you're asking whether Ottoman government devised new methods, new measures like quarantines or seclusion, isolation areas, well, it came, yes, a little later. But this is actually something I cannot really answer for each period. But I know, for instance, one example from the 17th century, that from the Mühimme defterleri, the Register of Internal Affairs or Important Affairs, we see that in the years like 1608, 1609, there was a big plague hitting not just Istanbul, but also Egypt and some cities in the Levant, that immediately they were asking to take precautions. The Qadis were informed about reducing the number of travelers. So I think that is part of that earlier experiences coming more in their like toolbox to fight. But this is really a difficult question to answer, Hussein.
Thank you.
Okay. Hi, Günhan. It's great to see you.
Hi there, Fikri. Great to see you. One of my former
My
students.
question.
Where are you, by the way?
I'm in Minnesota now.
Okay, good, good.
Thank you so much. So it's great to see you again. I'd like to ask you, how did the Imperial Palace take the protective measures for the members of the dynasty during the time of the pandemics? I know you invested your time in this issue. Would you tell us more for the specific measures for the specific members of the dynasty, which are extremely vital for the continuity of the Ottoman Empire?
Thank you, Fikri. Another very good question, and a little bit difficult, despite I've worked on this topic. Well, of course, Ottoman Empire was a dynastic state. I mean, many things centered around the dynastic family. So protecting the family, protecting the sons and the larger family was at utmost importance. In the Imperial Palace, Topkapı Palace, of course, there were strict protocols, you know, about the hygiene, and also there was a very, I would say, good group of medical experts, the royal physicians, doctors, and they were in charge of course, following any, you know, like sign of a epidemic or a disease. So in that sense, the palace was perhaps, we can say, better protected than any other institution, any other maybe area. And when, for instance, in the case of smallpox, that which I wrote on, which I didn't publish, but I know this from the Italian ambassadors' like dispatches, that immediately they isolated the people from the infected sultan. So that's, for instance, they knew apparently that this was a contagious disease. Second, of course, they followed some old recipes for the treatment, and there was a Jewish, actually, medical expert. Actually, she was the wife of a Jewish physician from the times of Murat III, that she treated the Sultan. So I give this example that whenever who can claim to have the cure for the infected person in the palace, it was immediately called and asked for his or her help. Other than that, the problem with the palace is this: it is crowded. So if any contagious disease get in, next thing you know, before you can be safe, you can be secure of it, already hundreds die. And indeed, in the early 17th century, we have numbers around 700, 800 dying in a given month because of smallpox. So yeah, in that sense, there are also not that much effective measures they could implement. I don't know whether this will answer your question.
Yeah, yes, perfect answer. Thank you so much.
You're welcome.
I have a quick question. This is Cengiz.
Hi, Cengiz.
Hi, Günhan. How are you? Great to see you. Great to see you. I'm sorry that, you know, part of me had to attend the departmental meetings, but a larger part of me had been listening to you, but I might have missed some of the great points that you had done. And thank you very much for this great summary. I know that you are limiting your talk to the Ottoman context, saying that, you know, you are dealing with endemics, but still, we all know that, you know, those things could not be studied without looking at the larger global context. Yeah, you know, what's your, like, you know, sense of, like, Ottomans being aware of what was happening beyond their territories? I mean, when they were taking measures with regard to like you know, those diseases. How much they were, like, aware of what was happening in Europe, or, like, you know, say Middle East or Asia or other parts? I mean, did you get a, like, sense that they knew what was going around them? That's one thing. And secondly, this is somewhat, you know, actually stretching to the 19th century, a century that I've been like dealing mostly in recent years, where I also look at missionary records immensely. And then missionary, what I see is like in missionary records, they are full of anecdotes, sometimes even like some systematic, reports on diseases. And to the best of my knowledge, as I'm just a reader of course, this scholarship, which is new, the rising scholarship on disease and environment and whatnot in the Ottoman context. What I realized that, the missionary records have not been used effectively, let alone systematically. Do you have any interest into going to that route? I know that we have like more of those records in the 19th century, but I know that there have been like records, missionary reports and letters and, all other things from 17th and 18th century too. And as I said, they're like full of references to the diseases in many cases. And actually, one of my arguments about the missionary activities in the 19th century, that they were informed and also shaped by those diseases. I mean, they in a way they decided where to, for example, have a station or where to move from where. All depended on the diseases. I mean, when there is a rising disease in some cities, they change their position and then move to another city. In a way, it has been a great part of their projects and plans and whatnot in the 19th century. Maybe because of that, they paid very good attention to those diseases. So to make the long story short, I mean, I'm just wondering why scholars now in our Ottoman studies are not making a good use of the Ottoman, mission records. That would be it.
Thank you, Cengiz. Let me start from your second question. Indeed, I actually just looked at Lean Martin's book, which is the Plague, ? Jesuit accounts on epidemics in the 16th century. So indeed, but for any topic we study for Ottoman history, right, we have to utilize any sort of related material. So Jesuits, of course, as they are mobile, traveling, stationed in certain regions of the Ottoman Empire from the late 16th century onwards, definitely provide some crucial information. So in that sense, absolutely, but it's not just the Jesuit missionaries, of course, or any missionaries, but other travelers, ambassadorial networks of people. So,
may I just inject in one more thing? This question actually related to the first question, because since those ambassadors and then merchants, but particularly missionaries coming from other countries, mainly Europe, and then in the 19th century from the United States, they were in a better position to compare too. That's why they would be able to give us a comparative perspective as to how things were being dealt with.
Indeed, and that's actually a problem, because when they compare, for instance, the reactions of the Venetians, to the Ottomans, or I don't know, the French to the Ottomans, they typically, come with their baggage in that sense. And of course, it's very tricky to study, for instance, what Hussein also asked, how do they approach the problem? I mean, mentally, intellectually, scientifically. Well, as I always say, first of all, in the face of this kind of a, threat, yes, I mean, some people can be just fatalistic, yes, but not all. And this is the important point to keep in mind, because the Jesuits sometimes, mentioned, Ottoman Turks, Muslims, they just are more fatalistic than others. So there are some different accounts on that. But I totally agree that they are very, very valuable, if not invaluable, sources to get to the details of the impact of these diseases on the larger communities living under the Ottomans. There are also other types of, I would say, narrative sources. For instance, that's why I mentioned these two Armenian deacons or priests, that they also travel within the empire, and they do have, for instance, people they know. For instance, Zakaria goes to Izmir and see his, colleague in the church of Izmir. So they also share a lot of these knowledges. So that connects to your first question. I think one thing that recently came into our attention in a kind of new scholarship is that the networks of intellectuals and experts shared information with each other. So it's not just the books, they read, translated, or edited, but also the mobility of these scholars, including medical experts in them, coming from different parts of Eurasia, entering into Ottoman lands, sometimes finding some good patronage from the palace or some pasha household. They actually provided the knowledge of other places. But this is actually a brand new agenda. I know Nükhet Varlık, again, are very expert on the history of plague and diseases in the Ottoman Empire. She had been working on the prosopography of the medical experts in the Ottoman history, early modern period, to figure out, for instance, what kind of knowledge was available to them. So I think this is a question yet to be answered very soon.
Hopefully. Soon is too optimistic, but yeah.
My take on this question is that definitely Ottomans were aware of what was going on around them. I mean, just consider, for instance, what our colleague Emrah Safa Gürkan wrote about the informants and spies in the 16th century. I mean, it turns out that, as we say, a nail falls on the streets of Venice, they hear it in Istanbul. So I think if there's any significant, first of all, threat, spreading disease coming their way, they probably knew it. They probably hear it before. But your question is more specific, I think, about the implementation of certain new measures. Well, that's, as I said, we need to know more in the coming years ahead.
Thank you. Thank you.
Thank you. Good to see you too. I see many names also, my former students, colleagues, but no faces, but I'm happy to reach out to you through this occasion. Thank you, Hüseyin, again, and Ayşenur.
Actually, I'd like to ask one more question before we end, and that perhaps tie it to the main theme of our lecture series, Muslim religiosity. And there is a tremendous scholarship to tie confessionalism, messianism, and religiosity to catastrophes, all kinds of catastrophes, from earthquakes to plagues, including the very book Cengiz wrote on the messianism of 17th century. There is some arguments about the rise of Kadızadelis, for example. But more specifically, I'd like to ask you whether you observed any noticeable reactions different from each other among different Muslim communities, namely jurists, Sufis, Chelebis, if you like. So how do Ottoman Muslim communities react in their own ways to these plagues?
Now I'm sweating on this question, Hüseyin. Okay, I recently read something truly amazing from the middle of the 17th century. This Sufi, I would say a Sufi mystical figure, don't know his name for sure, but I think he's Hassan. He's probably from Crimea. And he seems to be a Qadiri dervish. Qadiri is, like I think even a sheikh. And he has all these poems. His Mejmua is around like 1,000 pages long. I mean, he was very productive also. And he's writing all about the calamities, all about these, occurrence of the fires and disease here and there, blaming, the Muslims because they are not following the right path, doing what, the Quran and the Prophet says. So in that sense, he's a very, I would say, blunt voice, criticizing his own fellow, Muslims about, in the face of these threats, very, I will say, severely. And he, even at one point, he doesn't stop blaming the Sultan and saying that if you continue like that, who's Murat IV, by the way, that death is also, you know, something will come on you. So I think considering these kinds of examples, indeed some took it much seriously, much, I will say, to the heart, and maybe because of the fear, because of the anxieties. I think that's what I can say. But confessional divisions, I don't really know much about that. I should honestly say. The role of disease definitely known to affect psychology, communal also feelings, emotions. People became desperate, and imagine like we experience today. I mean, back in April, May, yes, we were going through some shutdowns, but you know, it was new for us. But I know that when I'm talking, my friends, my students, you know, we feel more depressed now. You know, so that's actually the much more, I would say, darker view when we look at historical periods, because as I try to explain in the charts, that almost every single year, almost every single like 2 years, that there's some sort of a disease in a given locality. So people must have felt more desperate, tired, maybe also exhausted, if they survived, of course, that epidemic there, and perhaps more receptive to certain, you know, ideas that they hear from, for instance, a sheikh like this Hassan, you know, saying that that this is also the fault of the ruler, this is also the fault of the imam in the mosque, you know. So I think, yeah, there is that definitely different voices, different arguments going on because of the shadow of these diseases looming over them. But I don't know any work, any study yet to be had done on this. Maybe someone knows in our group now.
I don't recall either.
It is, you know, impressionistically speaking, I mean, I really doubt that there could be much differences among the groups in reacting to the diseases, right? I mean, they, as you have been like talking about like COVID and its impact on all of us, you know, left and right. I mean, not much at the end of the day is that we are all kind of depressed and almost helpless. And I assume, I suspect that, you know, that there could not be that much difference. The other bigger question in that context, about which there has been like more studies, the connection between calamities and then rise of religiosities, right? Like rise of, you know, messianic fervor in different parts of the world. And but I mean, recently there has been like some doubts on that connection too. That, you know, in times of calamities, there was this rise of religiosity and end of the day and the end of the day scenarios. And as you have been like talking, I mean, it's like describing. I mean, there has been always some kind of diseases and contagious epidemics and then big calamities in any given time of history, both in the Ottoman Empire and abroad. So, I mean, if there was rise of religious and messianism at some point, it was not easily, or it could not easily be, you know, ascribed to such calamities. That's kind of like my impression, but it's all pure impression. I mean, we can't know for sure.
Cengiz, I think one way to put this is like, we should list down, for instance, what we see in a given, let's say, decade. Right. In the 17th century, for instance, I can say, for instance, certain decades are definitely a decade of troubles. Like it's a full package that you have: wars, disease, economic, you know, crisis, political crisis, you name. And indeed, I think it's not that difficult to, for instance, in this Hassan case, that it is exactly in that decade, which is 1630s, that, you know, that he's voicing over such, I would say, sharp, very harsh criticisms against his fellow Muslims and the ruler. So indeed, I think there might be some times, and indeed there are times, that more factors, more pressures come together and create, I would say, much more direct link between that religiosity and the disease in this case, or the factors we are talking about. We just need to be fine tune for the sub periods, I would say timelines there. But this is actually another field to go on in terms of diseases.
Dr. Börekçi, there was a question in the chat box. So Jacqueline Hoover asks, I was intrigued by your quote on Christians having to sell their children to Muslims. It implies that Christians didn't have enough to eat, whereas Muslims did. Do you know more about the scenario? Thank you. Okay, thank you so much. I just quoted this passage because, first of all, it's a nice testimony about the impact of the disease on the very daily lives of people, and how it actually overlaps with the famine. Again, it's very goes like hand in hand. The fate of these children, for instance, I don't know. I mean, I didn't follow on what happened exactly on the ground. I didn't check any other sources, but I do find this as a remark on how also under epidemics, people can go over the established boundaries of their, status life. What I mean is that, well, we typically assume, Muslims live in their own community, Christians live their own community, but apparently that's not the case. So, but this is a really extreme case. I try to mention that such a famine, by the way, the famine is confirmed by other also primary sources that was the year that there was a severe famine in the Aegean world around Izmir, and hence people couldn't do much but try to save their kids from dying. And honestly, I am actually the son of a mother who actually went through the same story, that my late mom from the village, they were desperate back in the World War II years, that she was given to a wealthier family to be raised. So indeed, I think this is not that surprising. This shouldn't be that much surprising that back in time, especially under these circumstances, that people, yes. But if the question, if I understand right, that about the selling, it might be actually a stylistic way to put it. But what I particularly find in this quotation is that the Muslims embrace these kids as their own. And we know, for instance, again, another cultural, I think, historical case, that what happened during World War I. And there are several families, separated, Armenians, especially in that sense, that ended up being raised by Kurdish or Turkish families. So I think calamities create also this problem, and disease definitely has a similar effect. I don't know whether this will answer the question.
I think the question was about if the pandemics hit different communities equally or not. So why do Christians have to sell their kids, whereas the Muslims could just buy? Because buying also means you add another mouth to feed into your family, which means maybe you are not as hit by the disease as the others. I mean, so I think the question was about this kind of unequal experiences during the pandemic.
I see. Thank you about that. Well, I mean, that depends again on the circumstances of the case. If Muslims better doing in this case can take these kids, or vice versa, some other families, but there are of course some boundaries. Maybe it's hard to see, for instance, a Muslim kid
given to a non-Muslim family to be raised, maybe in that case, a wakf, for instance, can be, stepping in, because we know that, in these cases, there is a charity that is also trying to provide, for instance, at least some basic needs for the survivors of the fires, survivors of the calamities. So I'm not sure what will be the more specific aspects of it, but I think it just depends on the very circumstances of a region. Anyone who could have taken the kids, I will assume that. But this is a very good question, actually. Perhaps someone should work on this. What happens, especially to the kids? Children history is another important history.
All right, so if there is any question, we would like to end. And thank you very much, Günhan, for sharing your insights. And I know you are into this topic very recently, and we expect to read the outcome of your new research. But just allow me to make a brief comment on the basis of your lecture. That as a historian myself, I was always intrigued by the fact that despite all the calamities and plagues and catastrophes in the Ottoman Empire, there is relatively less number of passionate literature on the topic. And especially after the graphs you show that statistically how frequently it occurred in the Ottoman Empire, it led me to think that it might perhaps be taken as more normal, quote unquote, than the moderns. So modern COVID was kind of a shock to everyone in this world. That's why we all outpoured these passionate reactions. But the Ottomans look like it's sort of an ongoing thing. So they were more used to live with plagues almost in their days. So it's not something you'll see once in your lifetime in a generation, but you see it multiple times. So perhaps they were better prepared, at least psychologically, to react that. I'm allowed.
No, that makes total sense. Thank you.
Okay.
Thank you also for, again, the invitation, for this opportunity. I hope I managed to give some ideas, general ideas at least, but maybe we can just specifically organize a series of conferences on the history of diseases in the Islamic world in different time periods, and that would be great.
Let's work on that.
Let's work on that. Okay.
I hope to see you again in our future events.
Thank you so much, Hussein. Stay safe, be well for everyone.